Welcome to Chapter 3 of Medical Law and Ethics. Throughout the course of this chapter, we will cover the following learning outcomes: define licensure, certification, registration, and scope of practice as they apply to requirements for individuals working in healthcare. Define accreditation as it applies to healthcare facilities, managed care organizations, and educational programs. And summarize the purpose and scope of authority for a state's medical practice acts and medical board requirements. We will also explain the changing configuration of the business management aspect of medical practice, distinguish between the different types of managed care organizations, and discuss the major federal legislation enacted within the intention of improving the American healthcare system. Here's a list of key terms that we will cover in this chapter, and if you haven't noticed, there is a lot of acronyms to learn. Some of these will reflect back in the following tests. Employees in healthcare facilities are, with few exceptions, either licensed, registered, or certified to perform specific duties and tasks depending on their job classification and state requirements. Licensure is a mandatory credentialing process established by law, usually at the state level, that grants the right to practice certain skills or endeavors. Licenses to practice are required in every state for doctors, RNs, PAs or physician assistants, nurse practitioners, dentists, pharmacists, psychologists, optometrists, occupational and physical therapists, dietitians, and many other healthcare practitioners. In most cases, in order to obtain a license, specific degree programs must be completed, followed by occupation-specific exams in their field of study. Individuals who do not have the required license are legally unable and prohibited by law from practicing health care professions inside of that state. Licenses to practice can be revoked or suspended in certain circumstances. Things that could lead to license suspension or revoking are sexual misconduct, substance abuse, professional discipline for criminal convictions or unprofessional conduct, fraud and/or misrepresentation, patient abuse, medication violations, unethical behavior, poor documentation or record keeping, and unlicensed practice. So something as simple as forgetting to renew their license in time could lead to their license being revoked. Because licenses are state-specific, when moving a practice to a new state, practitioners must obtain the proper credentials before seeing patients. In many cases, reciprocity is granted. This means that the state licensing authority will accept their valid license from another state as proof of competency without requiring re-examination. If reciprocity is not granted when moving to another state, then the healthcare practitioner must apply to the state licensing authority and take the required examinations to obtain a valid license to practice inside of this new state. Physicians and other practitioners can be licensed in more than one state at a time, but periodic license renewal is necessary. This requires keeping up with fees and continuing education units. For employees in healthcare, a specific scope of practice is assigned for anyone carrying a license, registration, or certification. These include the duties and procedures that a person may or may not perform under delegation, or authority of a specific license. These duties are determined by each state's laws, regulations, educational requirements, and licensing bodies. Often, the scope of practice for a specific licensure, certification, or registration can be found in state laws, under medical practice acts, or administrative code sections. Professional associations are a great resource for learning more about the scope of practice for a specific profession. An example of scope of practice is, as a phlebotomist, you are licensed to draw blood from a patient. You are not licensed to give any type of medication. So in an IV start, they always flush an IV. Well, even saline is considered a medication. So as a phlebotomist, you cannot start an IV because you cannot flush it to see if the IV is good. We have covered licensure, and now we'll be moving on to certification. Certification involves a voluntary credentialing process where applicants who meet specific requirements may receive a certificate. Certification is usually national in scope and is most often sponsored by a non-government private sector group. It is usually done by a professional organization through examination. For phlebotomy, ASCP is the gold standard of certification. Because certification is voluntary, lack of certification usually does not prevent an employee from practicing or working in the profession. And in order to keep up certification, there are yearly CEU or continuing education units and a fee. While it's not required, certification can oftentimes help you get a job because you have taken that extra step, that extra educational leap in order to further yourself in your career. Similar to certification, registration now requires certain educational requirements as well as possibly completing a national exam. It originally began as a procedure where individuals could just enter their names on a national registry. Little proof of competency was required. But over the years, the process has changed to where now proof of education from an accredited college is usually required, along with successful completion of a national exam. Under no circumstance may a person claim to be licensed, certified, or registered if they are not actually licensed, certified, or registered. Unlike licensing, certification, and registration, accreditation does not refer to a qualification process. It instead refers to a process for authorization, approval, and recognition of quality in healthcare education programs, facilities, and care plans. It represents these places as credible, reputable, and dedicated to ongoing and continuous compliance with the highest standards. Accreditation is usually voluntary. At the time of an accreditation survey, healthcare entities must also demonstrate how they have maintained continuous compliance records and standards for accreditation. The Joint Commission is an independent, not-for-profit organization that accredits many types of healthcare organizations, including but not limited to the following: general, psychiatric, pediatric, rehab, long-term acute and specialty hospitals, home health services, durable medical equipment services, hospice, nursing homes and other long-term care facilities, assisted living facilities, behavioral health facilities, outpatient surgery facilities and rehabs, as well as office-based surgeries, and clinical laboratories, including independent and freestanding, as well as inside of hospitals, blood transfusion and donor centers, nursing care facilities, and physician offices with labs. In order to earn and maintain the Joint Commission accreditation, organizations must undergo an on-site survey by a Joint Commission survey team at least every 39 months. Laboratories must be surveyed every 2 years. This is usually a very stressful visit for these facilities because they will go through with a fine-tooth comb and look for things like expired tubes, incorrect paperwork, things filed in the wrong spot, small things like lids not being on containers, and you'll get a report of any inconsistencies or failures that they find. Educational programs are also accredited, and again, this accreditation refers to its credibility, reputation, and dedication to ongoing and continuous compliance. These accreditation programs will evaluate the effectiveness of an educational program. Does the program meet the broad and specific professional standards? Do the classes offer enough practical experience and procedures required for certain job categories? Are there enough credit hours to gain the sufficient knowledge to pass licensing exams on completion of the program? Are the instructors and advisors available if students have questions or need help? Are their concerns dealt with in a helpful and timely manner? Accredited programs tend to be more thorough and better prepare their students for the workforce. Medical Practice Acts. In all 50 states, Practice Acts, or state laws written for the express purpose of governing the practice of specific healthcare professions, have been established to govern the practice of healthcare practitioners. The primary mandates or purposes of Practice Acts are to define what is meant by the practice of the individual profession in each state, explain requirements and methods for licensure, provide for the establishment of licensing boards, establish grounds for suspension or revocation of license, and give conditions for license renewal. Each state periodically revises its medical practice acts to keep them current with the times. Each state's practice acts also mandate the establishment of professional boards, whose purpose is to protect the health, safety, and welfare of healthcare consumers through proper licensing and regulation of healthcare practitioners. Through licensing, each state board can ensure that all healthcare practitioners who work in areas for which licensing is required have adequate education and training, and that they follow high standards of professional conduct. Applicants for license must generally prove their education and training, provide details about their work history, pass an examination designed to adequately assess their knowledge and their ability to apply that knowledge, and reveal information about their past medical history. So things like alcoholism or drug abuse, arrests, convictions. Each state's practice acts usually define unprofessional conduct for healthcare professionals as well. These are the things that can lead to suspension or revocation of their license. This list is similar to the one we had earlier and includes physical abuse of a patient, inadequate record keeping, failure to recognize or act on common symptoms, prescribing drugs in excessive amounts or without a legitimate reason, impaired ability to practice due to addiction or physical or mental illness, failure to meet continuing education requirements, performance of duties beyond the scope of a license, conviction of a felony or delegation of the practice of medicine to an unlicensed individual. So if the doctor is allowing their medical assistant to diagnose things, that would be considered delegation of practice of medicine to an unlicensed individual. Medical practices are changing with the times. In the past, most physicians were either solo or in small group practices. But today, healthcare is very big business, and medical practices are owned by corporations instead of small individual groups. Staff must be able to manage a variety of challenges, from managed care protocols and federal regulation. Managed care organizations, or MCOs, are a system in which financing, administration, and the delivery of healthcare are combined to provide medical services to subscribers for a specific fee. To put that in different terms, managed care plans make agreed upon payments to providers, which is hospitals or physicians, for providing healthcare services to healthcare subscribers. The payment from a managed care plan can be one of several types. It may be contracted fee schedules, a specific payment for a specific service, a percentage of fees or a percentage of the amount billed, or capitation, which is an advance payment made to providers based on a calculated cost of medical care for a specific population. In order to keep costs of healthcare down, managed care facilities have come up with cost containment measures such as coinsurance, copayments, deductibles, formularies, and utilization review. Coinsurance refers to the amount of money plan members must pay out of pocket after the insurance plan pays its share. For example, the plan may pay 80%, and the subscriber might have to pay the other 20%. Copayment fees are flat fees that you pay when you show up for a doctor's visit, such as a $20 copayment each time you go into the office. Deductible amounts are specified by your insurance plan. So your deductible may be $500 a year, or you could have a high deductible plan, which it may be as high as $5,000 a year. And insurance does not begin to pay until after you have met that deductible. Formularies are a plan's list of approved prescription medications for which it will reimburse its subscribers. So they may not cover every form of a medication. They may only cover the generic or only cover certain name brands. Utilization review is a method used by health plans to measure the amount and appropriateness of health services used by its members. So they are going to make sure that there is still gains made. If you are in a rehab facility, you have to be continuing to advance and gain for them to continue to pay for your care. And lastly, plan-approved costs are the actual costs the insurance plan and the provider have agreed are appropriate. For example, a laboratory may charge $50 for a CBC, but the insurance company and the laboratory have agreed that they will run CBCs for $15. There are many types of managed care businesses. The first of which is health maintenance organizations, or HMOs, which are a health plan that combines coverage of healthcare costs and delivery of healthcare for a specific payment. These are usually group HMOs, which contract with independent groups of physicians to provide care for a large number of patients for a fixed per member fee. They often provide medical care for members of several HMOs, and the group model HMOs usually include prepaid group practice physicians. These physicians are salaried employees of the HMO, and they practice inside of facilities provided by the HMO, and they will share in profits at the end of the year. Staff model HMOs employ salaried physicians and other professionals who care solely for the members of a single HMO. Subscribers to this type of HMO can see their doctors, get lab tests, x-rays, prescriptions filled, even order eyeglasses and contact lenses, all in a single location. Staff model HMOs also employ some specialists, or they'll contract with outside specialists for unique cases. Independent Practice Association, or an IPA, is an organization that is owned by a network of independent physician practices to contract with employers and/or managed care organizations such as HMOs or PPOs. PPOs, or Preferred Provider Organizations, are managed care plans that contract with networks of doctors and hospitals who provide services for a set fee. Members can choose their health provider from an approved list, and if they choose to go outside of the PPO group, they must pay higher out-of-pocket costs for that care. A PHO, or Physician Hospital Organization, is another type of managed care plan. PHOs are organizations that include physicians, hospitals, surgery centers, nursing homes, laboratories, and other medical service providers that contract with one or more HMOs, insurance plans, and/or directly with employers to provide health care services. An EPO plan, or Exclusive Provider Organization, is a managed care plan that pays for health care services only within the plan's network of physicians, specialists, and hospitals, except in emergency situations. Some different legislation that has affected managed care is the Health Care Quality Improvement Act of 1986, the Health Insurance Portability and Accountability Act, or HIPAA, of 1996, and the Patient Protection and Affordable Care Act, or Obamacare, of 2010. Thank you for joining me for Chapter 3 of Medical Law and Ethics.